Hello, everyone. My name is Donna, and thank you so much for joining me today. I'm going to talk about remote nursing. Another term is called virtual nursing, where nurses get paid to work from home. First, I'm going to give honor and glory to God because without God, I am nothing. The first thing I'm going to talk to you about is just kind of tell you a little bit about my background, and then I'm going to share some important information with you about the world of remote nursing. And it is a different little world, and it is so important to understand how it works. But first, let me share this. I have been nursing since I was in high school. And like so many of you, I wanted to help people. I still want to help people, want to make some good money along the way, and still be able to help people all at the same time, but not work hard or be stressed out. I basically started looking and researching how to work smart in nursing. And so that's how I got into working from home. Right now, I work as a part time care manager. I'm not going to go into too much about it. I'm going to say that what a care manager does basically is oversee the care of a patient and basically just make sure that they follow up with their doctor's appointments, that they go to all their specialists that they need, that they have home health if they need it, or if they need to go to an assisted living or a nursing home, whatever they need in order to stay healthy and stay safe and get all the care that they need. That's my job. I just oversee that. And guys, I can tell you, I love it. I love doing that part of nursing. I'm still helping, but I don't actually do the hands on myself, which is so nice, but I'm still providing care to people. And so, what I'm going to share with you today is that if you are watching this, you are considering remote nursing. Another term is virtual nursing, telemedicine, telehealth. And so, what I would like for you to do is in the comment section, tell me the area of nursing that you work in and why you are considering remote nursing. A lot of people have some various reasons. A lot of it is they're tired. Sometimes people are just stressed. Maybe they're short staffed. Or it could be just it could be a nurse that's like, I just want to see what else is available for a nurse. But whatever your reason is, if you would leave those comments, I would like to look at them and just get some insight and to understand why nurses are considering work from home. It is an investment in yourself to actually take on a remote position, and I'm going to share with you what that means. So basically, a lot of time when nurses are considering improving our life, the first thing that we do is look at going back to school and get a higher degree. And guys, I'm right with you. I have my associates and I'm working on my BSN. I have about 6 hours left to get my BSN. But in that process, what I noticed is that nurses who are getting their degrees, it doesn't really affect their life in a big way. I have a habit, and I've been doing this for the last few years, when nurses will say, well, I'm going to be graduating, I'm getting my BSN, it's an LVN, they're going to say, I'm getting my associates, or I meet RNs, and say, I'm getting my master's, and I say, okay, well, what are you going to do with that? What are you going to do next? Guys, can I just tell you, the majority of the time, the answer is, I don't know. And we all know what school is like. It's no fun and it costs a lot of money. We really need to know where we're going and what we're doing with all of this, this time, this investment that we're doing, um, because it can't really help us if we don't know where we're going. One of the things that I found out in my research is that whether a nurse has whether she's an LVN, an LPN, an RN with an associate's or a bachelor's or a master's, or even a PA, a lot of nurses don't understand that the biggest value that a nurse could add to her life right now, or his life right now, is to invest in knowing where nursing is going. That is the most valuable investment that we can make for ourselves right now, is to understand where nursing is going. Where is it now and where is it going in the future? And so I came across a class, and I'm so glad I attended this. It was just a little class, and they talked about technology, and they said that it was basically technology and healthcare and how it's coming together. So we all know about technology. We know how fast it's going. We know how it saves time, how we're into it. We're into technology when it comes to our phone, our computers, our laptops, and all kind of devices. But in healthcare, our country is very, very behind. And so one of the ways that they came up with to help our country get better in healthcare is to merge technology and healthcare together. And so this is totally new to a lot of nurses. We kind of heard about it, but we didn't really understand that this is our future in nursing, is merging healthcare and technology. And one of the major changes that they came up with to help our healthcare system is to use nurses in a total different way. To no longer be the bedside care nurse, but to actually use your experience and your education to help with care planning for patients. That's just one of the ways that we can help patients. And so I was reading this article today, and it said, where's the future of nursing going? And basically it talked about technology and nursing, and that is where the future of healthcare is going. It's going towards creating jobs where nurses are being utilized to help improve the healthcare system. And so that's going to be one of the things that I really share, is where are we going in the future of nursing, so that we can start to understand and shift our minds toward that understanding that nurses are going to be utilized in a totally different way, and the opportunities are already there. There's lots of opportunities. I did not realize how many opportunities for remote nursing is out there and available. I did not realize that. You don't hear that much about it. It's still fairly new, but guys, there's so many jobs out there, and I'm gonna keep saying that on every one of my videos. There's so many jobs out there. And today, what I want to share with you is about, I talked a little bit about telemedicine, because that's one of the jobs that they mentioned in this article. And it basically says that nurses, through virtual care, are going to help monitor patients. And so this particular job is not working from home, but it's also not bedside care. It's actually working in a hospital setting. But the nurse actually does is through video technology. They do assessments, they do care planning, they're monitoring the vital signs, and monitoring labs, and they're giving reports back. And so basically in the hospital setting, they still have the nurses that are going to be doing floor nursing, but now they're starting virtual care nursing, where Other nurses are going to that's their job, is to just look at data, look at the labs, look at the reports, and talk to the patient too, and then give this information to the doctor and also share it with the nurses that are working on the floor. Now, I don't know about you, but I would rather be the one that is looking at the patient um, from the computer and talking with them and just gathering information and looking at the labs and sharing that information. I would rather do that and be the one that is out there on the floor. Now, of course, when you're first getting started, we have to get that experience. I have put my experience in. I've had enough experience on the floor, so now, I'm ready. Now, as you hear me talk about this, what you probably realize is that when you are doing, or if you're doing bedside care now, you're already doing this. You're already um, doing an assessment, making a care plan, looking at labs. You're already doing that. But what they're finding out is that nursing is much more effective. Healthcare is much more effective when there's a separation between the bedside care and then actually care monitoring. And so that's part of the mindset that we have to shift to. We have to shift towards that healthcare is moving towards nurses being, in that role of assessing. The same person that's assessing is not the same person that's actually giving the bedside care. It doesn't mean that the nurse that is doing the bedside care is not assessing also, because of course, if they're there, they should be paying attention to, signs and symptoms. But I think it's a very good opportunity, and I'm sure you do too. And so hospitals are going to be adding this more and more. I see more and more postings about this. I'm hearing conversations about it. And guys, again, I'm going to continue to share information. This is so exciting. It's a great opportunity to advance yourself, not just with education, because I do believe in education, but this is a good way to advance yourself as a nurse and, promote yourself in your career. And I have some information that I'm working on. I'm putting together a course on how to get a remote nursing job where you actually work from home or either work in a virtual care setting. Some of these jobs are not actually working from home, but they're not bedside care, and you actually work in a virtual care setting where they have nurses and they'll have the laptops and the telephones that you can reach out to patients. And so if this video was a help to you, please click the like button. If you want to be updated when the next video comes out and when my course comes out, that's going to teach you step by step how to get a remote job, then click the subscribe button. And so I want to thank you so much for joining me today, and I'm going to come back very soon and share some more information.